quick question following up on the border. There was a filing yesterday in the Flores settlement that described, quote, shockingly deplorable conditions. This is at emergency shelters at 2 facilities in Texas. I do realize one of them is under investigation, that being Fort Bliss. But given that there's another one in, I believe it's Pecos, Texas, the administration strategy was framed early on to move kids out into HHS facilities, into these very facilities that are emergency shelters. That's what we were told over and over again when we saw those high numbers in CBP facilities. So given that these very shelters, the ones that the administration wanted to move kids into, out of CBP facilities, are now being described as shockingly deplorable. What's now the strategy to both improve conditions but also move those minors out of CBP facilities at a faster rate?
Well, that's always our objective. Both of those is always our objective. And the mission of HHS is to safely care for unaccompanied children until they can be unified with a parent or a vetted sponsor. We want to do that as quickly as possible. We also don't want to put kids in the hands of people who are not vetted. So there is a balance there. I will say that we are continuously working to improve the conditions and services required to safely care for children. So currently, I know we've talked about one of these facilities and the IG investigation, which we've been supporting and we have been participating in, and a number of the conditions have been improved at that facility. In the Pecos site, it has an on-site clinic with various medical services, including pediatricians, nurses, mental health professionals, physician assistants. It is compliant with the required ratio of medical and clinical staff to unaccompanied children. The children receive educational and recreational activities, including reading, art, indoor and outdoor games, journaling, and dance. And children at Pecos also have access to provided laundry service, calls to homes, appointments with legal and counseling. And currently, the children at the intake site at Pecos meet with a case manager weekly. We are continuing to assess and make sure children are treated with humanely, treated with care, and treated and kept safe until we can connect them with their families or a vetted individual to care for them further.
Given all of that, is the administration satisfied with conditions, specifically at Pecos, or would it support a similar investigation that's going on into Fort Bliss?
Well, that would be up to the Inspector General. We have, again, we remain committed to continuing to improve conditions where there are any concerns arise, and we'll continue to do that at this site and any other where they arise.
Just one more. Has the administration, why haven't we seen like a supplemental request at this point? Capacity has been an issue now for 6 months, at the border. Is the administration considering that at this point, and do you still identify capacity as an issue at the border?
Well, I think capacity issues we've made huge improvements on.
Specifically talking about beds. HHS facilities.
Correct. I know what you're saying.
Yeah.
We've made huge improvements, and when we've had this conversation a couple of months ago, the conditions were different. People were in the Border Patrol facilities for far too long. They were in these HHS facilities longer than we wanted them to be in. I think if we assessed that additional funding would help us expedite any aspect of the process, we would request those. But we also have some flexibility in the budget to make sure we have the resources needed.
Jen,